Nurses are on the front line in the battle against the pandemic. The new Omicron variant is a much more infectious form of coronavirus, and it's making the job of healthcare workers even more demanding. And they're at risk of infection every day due to the large number of infected patients. The World Health Organization estimates that at least 115,000 nurses worldwide have died from COVID-19. And there are staff shortages and burnouts. The pay is generally low and working conditions are harsh. In many countries, nurses are fighting for better recognition. But apart from applause as a thank you, they often get very little in return. Welcome to your COVID-19 special. I'm Daniel Winter. The jobs of healthcare workers were already demanding even before the pandemic. But once the virus struck, they took to the front lines and saved millions of lives. Around the world came an outpouring of appreciation. But did anything really change? Many doctors, nurses, carers and hospital workers believe their work has once again fallen out of the public's awareness, leaving them worried that things will never change for the better. To hear from the people themselves, we travel to Spain, India and Germany.
Working as a nurse has always been demanding, even before COVID-19 struck. But the pandemic has exacerbated the problem. Katrin Berger can feel the impact on her everyday life. The ICU nurse from Berlin is one of many who take care of COVID patients day in and day out. It's a back-breaking job. The physical strain is enormous. It's a huge strain working in this protective suit. And the psychological part also plays a big role. We take care of critically ill patients. That's our normal work, what we've been trained for. But now we have critically ill patients who can also put us at risk. This is really stressful. As the pandemic hit, nurses received a lot of praise for their efforts. But their working conditions didn't change. All the beds were full, and then there's constant stress for far too little money. Many also complain about lack of recognition. Nurses in Spain are especially dissatisfied. Hundreds of them were recruited to help out during the height of the pandemic, only to find themselves jobless again when the infection numbers dropped. They were informed by text message. I find this way of informing people about their dismissal really inappropriate. It shows zero respect for those who gave their all during the pandemic. They were desperately needed to keep the system working, and now it seems like they're just staff who are disposable. But the importance of having enough healthcare professionals is now clear to many countries, especially as the pandemic continues. Spain has also changed. We are currently putting in a lot of effort to create more permanent positions and ensure that fewer staff have to work in unsafe conditions. We hope the situation will continue to improve in 2022. For these women in India, the nursing problems in Europe opened up new opportunities for them. The caregivers and nurses gained a lot of experience during the pandemic. Now they want to offer help to European countries.
Pandemic is controlled in India compared to the Western countries, especially the UK. So I know that I can do the same for them also.
We have managed to contain the pandemic in the first few months. It was a model for the whole world. And we believe that we can do the same in all the other countries as well.
Katrin Berger in Berlin would welcome such support. The world may have to brace for a completely new era after all. The coronavirus may stay with us permanently, and we have to develop strategies. We have to strengthen our healthcare system with enough staff, with enough equipment, with all the necessary tools. Corona is not leaving us anytime soon. Creating better conditions for the caregivers. This will remain one of the key issues in 2022.
And we're now lucky enough to be able to speak to Christian Karagianidis, who's a lung specialist and intensive care physician. Thank you very much for joining us, Christian. So from your personal perspective, how are healthcare professionals coping with the pandemic right now?
Yeah, I guess it's more or less a routine now over 2 years, but most of our nurses and also doctors, we shouldn't forget them, are very tired at the moment. And you mentioned that before, that there was a lot of applause in the beginning, but at least in Germany it was not more. So we have not more staff. We even have less than that. 10 to 20% less nurses than before, and that's a major problem we are faced with at the moment.
So it sounds like you're suggesting that more should be done. What more do you think can in practice be done to support healthcare workers?
Yeah, one of the major points in Germany is that we have really a nursing crisis. And this nursing crisis began by far earlier than the pandemic occurred. And one of the major problems in Germany is a huge economic pressure on the hospitals, and that we have to treat many patients and have too less nurses and also doctors for it. And that is one of the major points. And the pandemic really had a huge impact on that, because you have to do more and you had to do more, and the workload was even higher than before. And that is one of the major points. And therefore, I guess the first thing we have to do is to lower the workload, and you can only do that if you have more colleagues. And the second point is that especially the nurses earn more money than they do at the moment in Germany.
So understaffing is a key weakness. What more should the government, should healthcare companies be doing to bring more, especially nurses, into the healthcare system, in your case, in Germany?
Yeah, let me give an example. In UK, for example, you have one nurse for one ventilated patient. In Germany, one nurse has to care for at least 2 ventilated patients during the night, mostly for 3 patients. And that is one of the major points we have in Germany. So we have to, I guess, we need, let's say, not a new healthcare system, but we have to reorganize the work, how we do that. We have too many hospitals in Germany, and that means that 2 less nurses per hospitals are there. And therefore, I guess we have to concentrate many nurses in one hospital to lower their workload and to make life easier. I guess that is one of the key points we have to do in the future.
Okay, so a reorganization, a stronger recruitment drive, and more pay.
Yes.
When we look at the situation that we're in right at the moment with Omicron, how has Omicron affected admissions so far as you can tell? Because we're hearing different messages. On the one side, it's far more transmissible. That is already very clear. On the other, early data appears to show that it could be a more mild illness.
Yeah, I fully agree with you. So it's very early now with Omicron. And in Germany, let's say we are 2 weeks behind the other countries in Europe, especially behind UK or France. And at the moment, the numbers are increasing. So in some parts, we have 10, 20. In Hamburg, for example, 40% of all cases are Omicron. But we have today only 8 patients with Omicron all over the country on the ICUs. So it's very early at the moment. But if you look at France or at UK, it seems that at least on the ICU, we have not such a surge like we expected 1, 2, 3 weeks ago. And I guess we need at least 2 weeks more to have a definitive idea if it's really less severe than the Delta variant. And that is what we all wish, at least for the ICUs, that the workload is lower and the pressure is lower.
Okay, so there's plenty still to do. Christian Karagiannidis, thank you very much for speaking with us.
Thank you.
And now it's time for you to ask and for us to answer. Here's a viewer question for our science correspondent, Derek Williams.
Who is considered a COVID-19 survivor? Is it regardless of its severity?
This is really more of a semantic question than a scientific one, but it caught my attention because I've used the term here quite often, but I've never really thought about it before. So let's think about it. The word survivor is a pretty dramatic one. The Cambridge Dictionary defines it as a person who continues to live despite nearly dying. Now, that definition certainly applies to the many, many people in this pandemic who contracted severe COVID-19 but didn't succumb to it. But not necessarily to everyone who tested positive for the disease. The two members of my immediate family who had mild cases of COVID-19, for example, they told me they wouldn't describe themselves as survivors. In scientific literature, the term is often, but not exclusively, applied to people who recovered after having been hospitalized with the disease. But there are also arguments for thinking of those who've recovered from even a mild case as survivors. Studies have shown, for instance, that there are increased longer-term risks for them as well of developing the range of symptoms commonly known as long COVID. And online support groups for the condition are full of people who got only a little sick from the initial infection, but have struggled ever since recovering with a wide range of ongoing life-altering complaints. Though I don't know anyone personally who suffers from long COVID, I'm certain that many of those who do would also consider themselves survivors who have to keep working to survive every day. So, long and short, there doesn't seem to be a really narrow definition of the word survivor in the pandemic. But because COVID-19 affects people in so many different ways, that shouldn't come as a surprise.